How many of you are feeling like this? This is just too big. Doesn't it feel overwhelming? What can we do? This shouldn't be a moment where we just throw our hands up and be like, we totally screwed up. There's nothing we can do. I don't believe that for a second. I actually think that this is the moment right here. This is our opportunity to totally turn this thing on its head. It's like we're driving the ship. It's going over the cliff. If you guys just all get with me behind the steering wheel, we can turn this around and go the other way. But we need people to do this together. And the very first thing we need to do is to start rethinking about health and reconceptualize health. So we're coming out of the 20th century where our conception of health was very much based in this gene or genetic paradigm. And there was this thing that had a stranglehold on our imagination, which is called genetic determinism, which is this belief that your genes are your destiny. So again, if you, and people experience this all the time, if you have a child with autism, one of the first things people will ask you is, is autism in your family? If your child gets a diagnosis of Hashimoto's, which is a thyroid autoimmune condition, they say, did one of your aunts or one of your child's uncles have that? Is it in your family? And all these parents are scratching their heads saying, no, this wasn't in my family. That paradigm, the gene-based paradigm, is a dinosaur. It's dead. And science is proving this out. And now we have a new paradigm that's taking over, that's capturing people's imagination, which is this notion of epigenetics, which is how the environment interacts with our genes. And our genes are expressed differently based on not only what exposures that we have in our lifetime, but also what our parents did, and that can be transferred down through generations. But now, more than ever, people are realizing that the environment matters to health much more than genes. The other kind of old conceptualization of health, the thing that's going to go by the wayside, is this belief in the magic bullet, the magic pill. So if you think about our experience with antibiotics, when we had antibiotics, we had this experience where they would save a life. You'd have somebody on their deathbed dying from some kind of bacterial infection, and then all of a sudden, science created this pill. They took a pill, and they lived, when otherwise they would have died. That is a profound experience. And I feel like for the last 75 years, we have put so much faith into that possibility that we can create a pill to cure you of your autoimmune condition, to cure you of cancer. But you know what? That is a dinosaur. There is no pill that is going to fix the chronic illness epidemic, because is there a pill that can eliminate the toxins in the environment, that can fix your gut, that can improve your nutrition, that can improve your exercise profile? Is there a pill that can do all of that? No, and you know what? People are starting to wake up to that. People are starting to understand that that's not what health is about. It's not about having a genetic condition for which you'll take a pill that will cure you. It's about the choices you make every single day. And as parents, we need to understand that we have to take responsibility for the choices that are being made for our children. And we have to teach them to make good choices. So this is now how people who are on the cutting edge are practicing medicine. People who are actually having sick patients that get better, they're using this model of healthcare, which is based on an understanding that health is at the intersection of the environment, your genes, and the choices that you make every single day, the things that you eat, drink, think, and do. This is 21st century healthcare. And if you're still participating in 20th century healthcare, where you believe that your genes are your destiny, and that if you just put enough money into research, you'll get a pill that will cure you, then you're following an old model. That's like, thinking that horses and transportation with horses is the wave of the future when the automobile's coming down the road. That's like completely being stuck in the past. And the reason why this model is going to take over is because people are beginning to see and understand that human health is directly correlated with the condition of our surroundings. I love this image, and you can't see it very well, But somebody created this, and I stole it off of the World Wide Web. And it's a picture of deforestation here, and in the bottom right corner, there's all this area that's been deforested, and these trees are made out to be like lungs. Just think about how beautiful that picture is, because it says what I'm trying to articulate so beautifully. Human health is dependent on our environment and the choices we make every single day. Again, if you choose to live more naturally, you're going to thrive. If you choose to live in this synthetic, artificial world, you might survive. You might get cancer and die. Your child might be sick, but you might survive. What do you want to choose? The other part of this new conception of health is looking at the individual rather than a one-size-fits-all anything. There should never be one-size-fits-all anything. No drug works the same way in every person. There should never be the same diet for every person because we're all different. And all these things that we didn't really pay attention to before matter. So, like, what's in your exposome? What kinds of things have you been exposed to? What are your thoughts and your beliefs and your attitudes? Because what you think is different from what you think, and both of you are going to be impacted by what you think, but differently. And what kinds of foods are you eating? What's your blood type? What kind of stress level do you have, and how do you manage that stress? What's your medical history? What is your life history? What kinds of experiences have you had? What kinds of traumas have you experienced? All of this matters to health, and it matters to you. And it is also going to determine how your health symptoms evolve and emerge, and how you can maintain your health. So now we have this way of thinking about our health that is completely dependent upon our environment, the environments we put ourselves into, and the choices we make every single day. So here's the problem. This conception of health totally makes sense. And we know that doctors are practicing within this mindset, within this paradigm, or having sick people get better. So how do we make this the standard of care?